Hello everyone, I'm Dr. Lim Chin Tat. I'm a private orthopedic surgeon as well as the medical director for the orthopedic practice and surgery. Thank you once again for tuning into this channel. I'm going to go through with you a little bit about anterior cruciate ligament injuries using one of the Zoom webinar talk. Anterior cruciate ligament injury is one of the most common sports injuries among athletes. Anterior cruciate ligament is also the most important ligament in the knee. The anterior cruciate ligament is in the center of the knee. It plays an important role in maintaining the stability of the knee, especially in rotational movement. It is especially important in sports such as soccer, basketball, and badminton. In my Zoom webinar, I will go through with you the risk factor for ligament injury, the signs and symptoms of the ligament injury, as well as the treatment of the ligament injuries. If you have any queries or questions, do feel free to write them in the comment section below, and I will do my very best to answer them. Thank you.
Okay, so having said all that, we should talk a little bit about anterior cruciate ligament tear. I'm not too sure whether anybody has any experience with the ligament tear, or friends or relative, or even did the surgery, okay? But it's pretty common. Okay, that is definitely the main ligament of the knee. Most of the other ligaments are treated non-surgically just with physiotherapy. It accounts for half of all knee injuries. As I mentioned before, female more than male. Okay, a few reasons because they have smaller anterior cruciate ligament. The ligament is smaller and the joints are flexible. I'm going to share how to check whether you got a hypermobile joint, and they have wider pelvis, and the muscle ratio is doesn't help with the landing, okay? And they have a weaker core stability. So actually a lot of this can be corrected, It's only the anatomy like the smaller ACL that cannot be corrected. So this is how we check for ligament laxity. So you can do it now actually. Okay, so it's a 9-point system, 9-point system. So if you can pull your thumb to your forearm on both sides, that's 1 point each. Again, so the thumb, I'm not too sure whether you can see thumb to the can touch. I don't have ligament laxity, so I can't show you. The thumb to the forearm, that's 1 point for each hand. And if you can pull your little finger all the way back 90 degrees, that's another point each for left and the right. So that's total of 4 points. And elbow. So this one you have to ask your partner to take a look. If your elbow can go the other way around, that means straighten more than straight. That's another 1 point each for left and right. And check the knees. Push your knee back. If your knees can go backwards, that's another 1 point each for the knee. So that's 8 points already. And keeping your knee straight, bend forward, palms on the floor, that's another point. If your palm can touch the floor with your knee straight, that's really amazing. Okay, so that's 9 points. That's the 9-point system for checking for ligament laxity. More common in the female, definitely, and there may be a reason why they have more ligament tear. Mechanism of injury, so it can be non-contact or contact. So bear in mind that even if you do non-contact sports, you can get an anterior cruciate ligament injury. And one of the more common, at least from my experience, badminton, because with twist and turn, they get anterior cruciate ligament tear. And contact, especially soccer, in the picture I show you that the tackle comes in from the outside of the knee towards the inside, and then they break the anterior cruciate ligament. Very common in soccer, basketball, skiing, and football. And ligament tear is not just about ligament tear. You can see the percentage of meniscus tear as well. So just to revise meniscus, just to recap, meniscus is the cushion between the two bones. It's the cushion between this. It's the cushion between the thigh bone and the calf bone. So it can be tear when you have an anterior cruciate ligament tear. You have 10% of cartilage injury. You may get other ligamentous injury. And if you don't treat your anterior cruciate ligament knee, you get more and more cartilage injuries and meniscus injury. So the natural progression is that they do get meniscus tear and they get the knee arthritis if they have a anterior cruciate ligament tear. And some of the factors that causes earlier knee degeneration in patients without ligament is higher BMI. That means they are heavier. If they already have a meniscus tear and if they have a cartilage wear and tear, so they are generally going to have more knee degeneration than others. So a lot of patients will ask me, so they will see me in the first 2 weeks and ask me, will I get better? Will I get better? So there's a wanted rule in this study of only about 80 over patients. So wanted will remain about the same. Again, they may need to quit the sports. Wanted will get better. They can go back to recreational sports. And wanted will get worse. This wanted is the problem wanted because they cannot cope with the activities of daily living. Example, they cannot chase after the bus when they need to. They have problem climbing stairs. So these are the group very easy. They definitely need something to be done. Okay, that is the problem group. So when a patient see me, I check their age, I check the gender, I check on their sporting activity and their occupation, because that would roughly guide me with the expectations and the treatment regime. I ask them for the knee injury mechanism, ask them about knee swelling and instability. I check them for swelling, I do some special tests. By doing this special stress test, where we actually try to destabilize the knee. If it's unstable, it's clearly there's an ACL there. So we can do X-ray, which is not very useful. You can see the X-ray, we actually can't see much. Some of them has a fracture, but it's not common at all. So in the end, we always end up with a MRI scan. Most of the time we do an MRI scan, is very high sensitivity and specificity, and it's easily available nowadays and not very costly. So a lot of times, especially if our examination, physical examination shows that there's ACL there, we will go on to do the MRI scan. So the main function of the ACL is actually to provide stability. Look at all the pictures here. They are all doing twisting motion. See, they are doing twisting motion, and they are twisting in some way, even when you play badminton. So these three sports I find that has the highest incidence of ACL tear. So of course, all of them will stand for non-surgical treatment first, right? Strengthen the hamstring, strengthen the quad. Proprioception, which is balancing exercise. Okay, so we're trying to teach them how to balance, re-educate the muscle to balance. Train the gait. We can do an ultrasound to eliminate the swelling. There's no role in wearing a brace, even a hard brace. And like I said, most of them will do. If you are not a high demand patient, you may just choose to live without ACL, which is perfectly fine. I always tell the patient, you can still do running, you can still do swimming, you can still do jogging, but you just cannot do exercise that needs twisting, like badminton, football. And some of them will decide to live with that. So if they fail treatment, and especially the group, the wanted group, where they cannot even function with the activity of daily living, we go for reconstruction, surgery. So you can see in this picture that the ligament is missing, or a very small part of the ligament is left over here, and it's definitely not tense, not taut. So it's not non-functional. So after the surgery, this is the new ligament, this is the thigh bone, and this is the calf bone. So the new ligament has now stabilize the thigh bone to the calf bone, the thigh bone to the calf bone. So what happened in the surgery is that this is the thigh bone, the tunnel in the thigh bone. So what happened, you can see the new ligament is slowly getting put into the thigh bone. This is a keyhole surgery, and we are looking at through a scope. So there's no big surgery, and we can actually do this using 2 small incisions. So now this is the new ligament, nice, thick, and shiny. It's easy to do the surgery, but I think it's about patient selection that's important. So like I say, I don't push all the patients for surgery. I tell them they can function without the ligament, but a few criteria will push me more towards surgery, depending on their career, like career soldier, career pilot, where they really need the ligament. Professional athletes, very easy decision. Actually, if you watch English Premier League, if they have an injury, ACL tear, when the swelling goes down, immediately they go for surgery because it takes 9 months to recover. So they will go for surgery as early as possible, but only after the swelling subsides. For patients who is unable to cope with the activities of daily living, it's also a rather easy decision because you really cannot do anything without the ligament already. And for the young and active, even though they're not professional, a lot of them would choose to go for the surgery so that they can do some recreational sports as and when they want with their friends. They don't want to feel handicapped. So we can choose either allograft or autograft. Allograft is a donor graft, so we normally buy it from United States, where it's really good quality control. Or we can take a graft from the hamstring. Okay, so the hamstring, we can take 2 grafts, either from the patellar tendon or the hamstring. This is a 1-hour operation. You have 2 scars here, and if you want to take your hamstring for the ACL, you have to make a bigger scar here to harvest it. So this is the one. So this is the new ligament that I pull into the thigh bone. Okay. So it's the same day surgery. You can go home on the same day, or you can stay for 1 night. You can start walking on the day of the operation. And important, physiotherapy is very important. It's a crucial part of the treatment. I would say 50-50. 50% is my job and 50% is the physiotherapy as well as the patient job. So do remember this close chain exercise. So it's very important. Close chain exercise is always safer. So in the form of prevention, if you want to start, you do a close chain exercise. So close chain exercise is an example where your feet is planted on something stable. It's like cycling is a close chain exercise. Jogging is an open chain exercise because your feet is always leaving the floor, leaving something stable. So there's more stress, there's more shear, there's more movement in the knee. So if you are starting out, you should start with close chain exercise, then you progress to open chain exercise. Light running in about 3 months and sport specific training for 4 to 6 months before you return to sports for in the next 6 to 12 months. So it's important to have a proper physio regime after the surgery and not run away.